Welcome GK and Nursing Exam Channel Jatano Lamshogo Nursing Job ni Examination Roko Mo question Norok ni Shamongo Nagnai Norok o channel Takon subscribe Kaya subscribe Kairi Fidinilene question number 1 Polio is transmitted through A. Water B. Air C. Food D. Insects Answer A. Water. Next, for eye examination, the instrument used is A. Stethoscope B. Otoscope C. Ophthalmoscope D. Percussion hammer. Answer C. Ophthalmoscope. Next, dehydration is caused in the human body due to A. Loss of vitamin B. Loss of water C. Loss of salt D. Loss of minerals. Answer B. Loss of water. Next, who is regarded as father of medicine? A. Paracelsus B. Aristotle C. Galen D. Abstract Hippocrates. Answer D. Abstract Hippocrates. Next, following is a contagious disease. A. Malaria B. Malaria C. Tuberculosis D. Hookworm infestation. Answer C. Tuberculosis. Next, thyroid gland is present in which part of human body? A. Chest B. Abdomen C. Neck D. Back. Answer C. Neck. Next, what is meningitis? A. Inflammation of the membranes that surround the heart. B. Inflammation of the membranes that surround the liver. C. Inflammation of the membranes that surround the kidney. D. Inflammation of the membranes that surround the brain and the spinal cord. Answer D. Inflammation of the membranes that surround the brain and spinal cord. Next, number of pairs of spinal nerves that exit from the spinal cord are A. 24 B. 30 C. 31 D. 33. Answer C. 31. Next, in 1860, Nightingale set up the first nursing training school at A. Petersburg, Virginia B. University of Edinburgh C. St. Thomas Hospital, London D. None of the above. Answer C. St. Thomas Hospital, London. Next, prothrombin is produced by A. Blood B. Spleen C. Liver D. Ovary. Answer A. Blood. Next, result of Montague's test is read after A. 6 hours B. 24 hours C. 48 hours D. 72 hours. Answer C. 48 hours. Next, which of the following is the most severe complications DPT are due to blank component? A. Diphtheria B. Pertussis C. Tetanus D. Adjuvant. Answer D. Adjuvant. Next, recommended site of administration of DPT in infants is A. Gluteal B. Deltoid C. Lateral aspect of thigh D. Forearm. Answer C. Lateral aspect of thigh. Next, sick test is used for which disease? A. Meningitis B. Diphtheria C. Pertussis D. Poliomyelitis. Answer B. Diphtheria. Next, period of maximum infectivity in mumps is during A. Incubation period B. Onset of swelling C. After swelling appears D. Prodromal period. Answer A. Incubation period. Next, most of animal fats are A. Saturated fats B. Unsaturated fats C. Monounsaturated fats. D. None of these. Answer A. Saturated fats. Next, thyroxine is secreted from A. Thiamine deficiency, B. Theological inheritance, C. Thyroid gland, D. Muscles used for breeding. Answer C. Thyroid gland. Next, a structural component of hemoglobin is A. Manganese, B. Zinc, C. Iron, D. Chlorine. Answer C. Iron. Next, in ethanol emulsion test, resulting emulsion is of A. Sky blue color, B. Cloudy white color, C. Cranberry pink color, D. Violet color. Answer B. Cloudy white color. Next, general feeling of irritability and tiredness may be due to lack of A. Proteins, B. Carbohydrates, C. Fats, D. Vitamins. Answer D. Vitamins. Next, largest internal organ in human body is A. Heart, B. Liver, C. Lungs, D. Kidney. Answer B. Liver. Protein deficiency result in A. Ricket, B. Kwashiorkor, C. Tetany, D. Pellagra. Answer B. Kwashiorkor. Next, powerhouse of the cell is A. Mitochondria, B. Golgi bodies, C. Nucleus, D. Cell wall. Answer A. Mitochondria. Next, the heat regulatory center of the body is A. Medulla oblongata, B. Thalamus, C. Limbic system, D. Hypothalamus. Answer D. Hypothalamus. Next, which part of the body is affected by typhoid? A. Lungs, B. Intestines, C. Liver, D. Pancreas. Answer C. Liver. Next, a clinical thermometer indicates temperature in degree Fahrenheit from A. 94 to 108, B. 96 to 108, C. 94 to 110, D. 96 to 110. Answer A. 94 to 108. Next, ELISA test is used to detect A. Malaria, B. Cholera infection, C. HIV infection, D. Lung infection. Answer C. HIV infection. Next, which of the following is not cancer? A. Leukemia, B. Glaucoma, C. Carcinoma, D. Sarcoma. Answer B. Glaucoma. Next, RCH program was launched in the year A. 1987, B. 1992, C. 1997, D. 1885. Answer C. 1997. Next, at community level screening of malnourished children with MUSC theft is the responsibility of A. Anganwadi worker, B. ASA, C. Anganwadi Sakia, D. Teacher. Answer B. ASA. Next, which is the true about pentavalent vaccine? A. It is expensive, B. It follow open bile policy, C. It replaced DPT first, second, third, D. All of the above. Answer D. All of the above. Next, which cranial nerve is the highest number of branches? A. Vagus nerve, B. Facial nerve, C. Trigeminal nerve, D. None of these. Answer A. Vagus nerve. Next, most common type of fracture seen in children is A. Colles fracture, B. Pott's fracture, C. Green stick fracture, D. Pathological fracture. Answer C. granulostic fracture. Next, suicidal risk is the highest in which of the following? Major psychotic, major depression, major drug dependence, severe mental retardation. Answer B. Major depression. Next, in which position should the nurse initially place a client who has experienced a brain attack? A. Prone position, B. Lateral position, C. Supine position, D. Trendelenburg position. Answer B. Lateral position. Next, most common cause of jaundice in newborn within first 24 hours of life is A. Septicemia, B. Biliary atresia, C. Physiological, D. Erythroblastosis fetalis. Answer D. Erythroblastosis fetalis. Next, who discovered the transmission of malaria by Anopheles mosquitoes? A. Ronald Ross, B. Leverand, C. Muller, D. Robert Koch. Answer A. Ronald Ross. Next, pap smear test for detection of carcinoma of cervix is which level of prevention? A. Primordial, B. Primary, C. Secondary, D. Tertiary. Answer C. Secondary. Next, zero dose of polio vaccine which is given? A. Before DPT, B. At birth, C. When child having diarrhea, D. When child having polio. Answer B. At birth. Next, oral thrush is caused by A. Bacteria, B. Parasite, D. Candida. C. Candida, D. Canon. Answer C. Candida. Next, the most common complication of mumps is A. Gingivitis, B. Orchitis, C. Urethritis, D. Cystitis. Answer B. Orchitis. Next, folic acid supplementation during pregnancy is recommended from A. Start of pregnancy up to delivery, B. Last trimester, C. 4 weeks to conception up to 12 weeks of pregnancy, D. 12 weeks of pregnancy up to delivery. Answer C. 4 weeks to conception up to 12 weeks of pregnancy. Next, flag sign is a characteristic features of which disease? A. Poliomyelitis, B. Marasmus, C. Rickets, D. Kwashiorkor. Answer D. Kwashiorkor. Next, the most significant sign of respiratory distress in preterm baby is A. Bradycardia, B. Nasal flaring, C. Barrel chest, D. Grunting and chest indrawing. Answer B. Nasal flaring. For next, encourage mother for breastfeeding. A. After placenta separation, B. Within 30 minutes of vaginal delivery, C. After 2 hours of delivery, D. None of these. Answer B. Within 30 minutes of vaginal delivery. Next, which of the following is the largest bone in human body? A. Femur, B. Humerus, C. Tibia, D. Radius. Answer A. Femur. Next, vitamin essential for coagulation of blood is A. Vitamin A, B. Vitamin K, C. Vitamin B, D. Vitamin C. Answer B. Vitamin K. Next, 1 gram of fat yields how many calories? A. 9 calories, B. 6 calories, C. 8 calories, D. 4 calories. Answer A. 9 calories. Next, conflict spot in sin. A. Chicken pox, B. Measles, C. Mumps, D. Variola. Answer B. Measles. Next, an example of congenital cyanotic heart disease is A. Rheumatic heart disease, B. Ventricular septal defect, C. Aortic stenosis, D. Tetralogy of Fallot. Answer D. Tetralogy of Fallot. Next, last question. Wilms tumor is a condition affecting A. Kidney, B. Bone, C. Blood, D. Brain stem. Answer A. Kidney.